Good morning, and so appreciative to be back here as a repeat offender for those caring about the visually impaired and blind in the greater Philadelphia area. VisionCorp has been in business since 1927 as a nonprofit dedicated to rehabilitation for the visually impaired throughout central and southern Pennsylvania. All right, what am I doing wrong? Our mission statement is to empower individuals with vision loss to attain independence. We have a secret successful sauce that has assured our continuity in the greater community. Our immediate concern is for rehabilitation and to reach out to as many individuals suffering vision loss in the area. And we are able to do that with little or no cost to everyone we serve from cradle to grave, because we have a very successful business enterprise entity, and currently we have 5, soon to be 6, employment entities throughout the greater Philadelphia area. These are not sheltered workshops. These are employment situations that pay a living wage with health care benefits and opportunity for growth and advancement. That really creates a dedicated workforce for the visually impaired and blind. We sustain employment in all 6 employment settings, as well as our headquarters, to be anywhere at 75 to 77% visually impaired and blind. So I'm a minority in my own corporation, and I'm proud to be one. Our rehabilitation is through a nonprofit service community, and we strive to help our clients with vision loss maintain and increase their independence, and we do that one-on-one. We travel to their homes, we travel to their schools and work with their educators. We work with family members. We rescue jobs in jeopardy, people that have had a sudden vision change and are at risk of losing their employment. We go in and facilitate in the workplace so they can maintain and continue to be gainfully employed. We know that in the employment situation for the visually impaired and blind in the United States is steady at 78% of underemployed or unemployed. And that is horrible, and that's a responsibility of all of ours to improve. We receive our clients in several ways: through eye doctor referrals, family physicians referrals, self-referral, and of course family and friends that become aware of problems that their peers are experiencing. Our low vision occupational therapy is evaluation of everyday activities, living experiences such as reading, writing, environmental adaptations to assist with vision, lighting control, magnification, eye shields, CCTV use, medication management, kitchen safety, day-to-day shopping, and meal preparation, and most importantly, in today's society, assistive technology training with computers and smartphones. And of course, we're all, along with orientation and mobility, looking forward to the use of the self-driving cars in the near future. That technology is increasing pretty rapidly. Through our orientation and mobility training, we help people navigate safely at home, in their immediate community, and to assess transportation throughout their network of employment situations, shopping situations, through transportation, buses, trains, navigating cabs, and Uber, which has been a tremendous boon. Our specialized service programs, we can provide some transportation for our clients, but we, again, have the goal and the vision to have our clients be as independent as possible. We have an eligibility requirement, and 20/70 in the better corrected eye, field restriction of 20 degrees, or central scotoma. Or if someone is just with low vision having major issues day to day with reading and writing, remaining independent, and of course, most importantly, the personal adjustment to vision loss. We have seen a sustained incidence of depression in clients with glaucoma. We have one lady who is in our services, and upon receiving her diagnosis of glaucoma, she went home to her apartment and isolated herself for 2 years. Family, helped her with her immediate needs, but she refused to do anything on her own because she was psychologically traumatized by her diagnosis. And until she, through peer pressure, recognized that there might be assistance for her, she suffered for 2 years. She finally, through urging of family members, did reach out to VisionCorp. She is now a very productive person in the community. She does ride public transportation. She does her own shopping. And her whole outlook on life and life expectancy has changed. We have another Franklin and Marshall professor, early diagnosis of glaucoma. And of course, he latched on to his diagnosis. And once he received referral for occupational therapy training, he was at our door every day because he was anxious to be proactive and beat this diagnosis. And he has. He's an avid gardener. He's still teaching part-time. He knows the public transportation grid of Lancaster County. He can navigate anywhere to New York City, Philadelphia, Washington, D.C. by himself. He does the stay-at-home care for a family of 4, all the cooking, the laundry. So nothing has gotten in the way of this gentleman. Doctors Cahook and Yoham, and you've seen Dr. Cahook mentioned earlier, did a study of 41 glaucoma patients and found that 12% suffered depression. 20% had significant memory impairment, and 1 of those 41 had severe anxiety. A similar study was done here called VITAL at Jefferson, and included 188 patients with macular degeneration. The 188 patients were divided into 2 groups, one receiving occupational therapy 1 hour a week for 6 weeks, and the other just receiving social work talk therapy. The group that received occupational therapy had less depression, were more accepting of their condition, and psychologically were facing their life with greater independence. The outcome of both of these studies, and this is a doctor speaking, stating that many care providers may not realize how prevalent depression is among people with low vision. And it's our duty as a healthcare provider to raise awareness of the problem and the availability of help. It's good practice not only to refer low vision patients to a mental health expert, but also suggest low vision rehabilitation and occupational therapy. Our shared vision is that our medical community currently is not primed to be reaching out for therapeutic assistance and mental health assistance when dealing with eye disease. So when you write that prescriptions, doctors, we want you to write a referral for social services or occupational therapy, even if the client states at that point they really don't think it's necessary. Give them our phone number. We'll hear from them within a couple months. But give them that option rather than having them come to you and asking where I can go for assistance. That's our shared vision. I ask you to reach out to me during our lunch break with any questions, comments you have. And of course, don't be afraid to ask your physicians and your care providers how you can be assisted with occupational therapy or specialized services in the greater Philadelphia. My contact name is there, and we're here to help you all. Thank you.
Thank you.